Serious, police officers and nurses, what's the most effed up thing you have seen on the job? There was a guy who was just released from the hospital and was developing suicidal thoughts. He got into his car that very night, ripped out the stitching in his stomach, and wanted to die in his car. Sometime down the road he decided he didn't want to die but went to go get help. The closest place was the military base. I was running the front gate that night. When he rolls up, he says to me and says help me. I look around and I see a huge red stain on his shirt. I call our BDOC via radio and alert them of the situation. The entire time I am just trying to make sure this guy doesn't look at his entrails hanging out. The last thing I need him doing is freaking out. Eventually my supervisor and patrols arrive on scene to take over. Once the ambulance arrived, they got the driver onto a gurney. Once the door was open, there was a pool of blood sitting on the floor of the driver's side. I was a CNA. I found an old woman floating in a couple inches of her blood in the bathroom. She slipped, hit her head on the sink, passed out, got up, slipped in her blood and hit her head on the toilet. She got up a third time and hit her head again. It straight up looked like a murder with all the blood. My co-worker was telling me to check her blood pressure. I just looked at her and said the medics will be here soon. I don't want to move her. Her blood pressure is probably low. My co-worker was pissed. I grabbed as many towels as I could find to help not ruin the carpet. Assisted the medics as best I could. And off she went to the hospital. She ended up living for a few more years after that before dying of old age. I've never seen that much blood before. The air had this weird iron blood taste to it. It was supremely effed up. EMT. The worst was the first child death I got called to. These young parents were bed-sharing with their baby and the covers got up over his face and he suffocated from the carbon monoxide. I'll never forget the mom's screams or how the baby felt when I picked him up. The baby was so far gone resuscitation was pointless, but we attempted it anyway for the parents. My partner had to pull her off of me because she was beating her fists against my back begging me to save him. He was 2 months old. For the dicks who inevitably think bed-sharing is completely safe as long as you're sober and blame the parents for drugs drinking, they were sober. They had tox screens done. The medical examiner determined the baby was not rolled on top of, was in the ER. A young girl was brought in, beaten and messed up. She was alert and oriented though, and was fighting with paramedics and ER staff about assessing her. Turns out she was only 12 or 13 years old, beaten by an uncle, and refused to say anything until her daddy showed up. Of course no one showed up, at least, when I last checked at the end of my 12-hour shift. Things that happens to children are the most effed up. Got a call of medical aid request. Male subjects and chainsaw related injury. Showed up and found a male in the middle of the street, head in one place, body in another. Chainsaw still running. Guy had found out his wife was cheating on him with his own brother. Got drunk, put the chainsaw up to his throat to show them a lesson. The chainsaw teeth caught his neck and just kept going. Wonder what medical aid they thought you were going to be able to deliver at that point. That's what we said. But sometimes calls for services like playing the game telephone as a kid, what you start with couldn't be further from what you end up with. That sounds horribly frustrating. I don't think of a completely severed head when I think chainsaw related injury. Well, I didn't before, at least. One of my patients sneezed out his intestines. He had a hernia so severe the skin had stretched to the breaking point, so all it took was a sudden increase in abdominal pressure and bam. So I have been a nurse for over 10 years and I have to be honest, so much of my experiences are not as gory or traumatic as so many others here and never will be. But for me, and I know that some of you might understand, the most effed up things I see and will continue to see is the horror of Alzheimer's, frontal temporal dementia, and Lewy body dementia. I tell you what, these PPL come in and they are polite and confused, able to fake it sometimes. Maybe their families have cared for them at home for a long time. Within hours often they realize they aren't leaving and the family is gone. The facade is over. They become mean and nasty often. All the traumatic weight loss, the refusing to eat, the empty look in their eyes. Begging to be released from their shell of a body in their own personal hell. Unable to verbalize the pain or confusion or anything they feel. The families going through this is sad too. But what I was reminded of was when some of these folks do get sick, or break a hip, or poop themselves. The amount of people it often takes to help them and clean them up, literally have to try to hold their hands down because they do not understand what's going on no matter what. So yes, imagine for minutes and 10 seconds little old lady who is 90 some years old in the shower with 2 or 3 staff because she's swinging and pissed off, but hasn't had a shower in over a week and starts with diarrhea. One girl gets sick, so old lady grabs the poop and starts smearing it on her, ends up standing on wet floor with other 2 gals and they're trying to hold on to her and keep her off the floor and get her clean, throwing handfuls of poo at the girls, the doorway, and the wall. And here comes Iowa Popcorn RN knocking on the door in her dress clothes as the assistant director of nursing, trying to help people, and gets poo landed at feet. Someone shooting themselves in the head with a crossbow bolt and remaining conscious, let alone not dying, and the bolt being lodged in the skull was pretty weird. A woman who fell and sheared most of her nose off except for a thin flap of skin connecting it was weird. A guy getting a socket from a mechanic tool embedded in his face was neat. A paraplegic with an ulcer-infected wound which totally exposed their tailbone part of their pelvis was a fun one. I dunno, does any of this sound effed up? These are just a few ER stories off of the top of my head. I'm an X-ray tech. Had to X-ray a guy's slong because he stuck little magnetic balls up his urethra. Surprise surprise, when he tried to take the string of them out they disconnected and got stuck. Cop here. Off the top of my head. Someone was carjacked and shot twice in the face and once in the back of his head at point blank range. When I saw him, most of his face and a large part of the back of his head was missing. He was not recognizable at all. Homeless person with an infected foot just came in last month. Foot was red and necrotic dead tissue. Little black holes everywhere. Poured some iodine and a few maggots came out. Another nurse suggested hydrogen peroxide, that hole bubbled and 1000s of maggots came bursting out. I can't even describe the smell. Ambulance calls over the radio. Infant male maybe 3-5 months old, found unresponsive and not breathing by family in bed, CPR in progress. Another baby code. We're a level 1 pediatric trauma center. Kid probably rolled over in the blankets and suffocated. Happens. Sadly, it's another shift for us. Get the kid moved over to the resuscitation room's bed. Bruises on both arms. Doesn't pass the sniff test. We cut the rest of the ONSI off. Start looking for an IV. Open up the diaper. Need a rectal temp. Trauma triad of death after all is hypothermia, acidosis, and coagulopathy, right? See some blood around the legs in the diaper. From the rectum? Lift a leg, semen and frank blood leaking out of rectum. Someone did the unthinkable to that baby. And there is no place in this world for people like that. I don't share that story often. People always ask what's the craziest thing. They want the shot in the face with a bow and arrow or hand caught in bread maker. But you're asked. The world is a horrible place. Bonus story. People put stuff in their pee holes all the time apparently. I've seen a baby carrot, Lego lightsaber piece, and a golf pencil. All different dues. Tie a string to it or something. My husband's friend is in his residency and told my husband a story about an elderly man that came to the hospital and they gave him a catheter. Apparently he really didn't want one and became angry about it and proceeded to pull the catheter out through his penis and then died because he bled to death. My father was a cop. The worst thing he ever talked about was when he and his partner went on a welfare check of an elderly woman who lived alone. No one had seen her in a few days. She had died while bathing. They had to stay as the coroner removed the body. As the coroner and his staff went to lift her badly swollen body, her skin came off. He says he vomited off and on for weeks after witnessing that. My dad was also a cop. He once told me a story of a man who killed himself in the bathtub. The note he left said he was sorry for the person that would clean him up off the walls, so he shot himself in the tub so it would be easier to wipe up the blood and brains. Imagine having that much concern for a complete stranger, but having none for yourself. I work in an operating room. Patient came in for surgery. Was using a loaded gun as a sex toy up her rectum, and it went off as she was doing the deed. Shot through her abdomen. Yeah, I see some weird shit come through. Well, it's not my personal story but a professor of mine who is a doctor. She was pregnant and still working at a hospital. Someone who was out of their mind on drugs and upper body, strapped to the table, ended up kicking her full strength in the belly. Placental abruption. She also fell back and cracked her head. She lost the baby. They had to do an abortion-like procedure to get everything out. She was left with a weakened cervix and lost several pregnancies since, but she did finally manage to carry a child to term. I imagine that for her colleagues, it ranked among the worst things to have ever happened on a shift. I mean, naturally, her too, just hard to relate a story secondhand. If you want more of the best Reddit videos from this side of the universe, please subscribe.